Deputy President. I'm rising tonight to report on the rural, regional and remote road trip I conducted during 2012-13 to learn about the mental health needs of people living in country Australia. When I set out on this, I set myself the task of gaining practical feedback from those who are working on the front line in rural, regional and remote mental health services, and to understand the experience of people living in the bush who are challenged at times by poor mental health. And I also wanted to understand how it is for their carers and their families. Rural communities are the backbone of our nation. They're not only important to our sense of who we are in Australia and our history, of course, but they're integral to our economy and ultimately to our survival. It's rural communities that feed us, help clothe us and provide the food that we need to sustain us into the future. In my home state of South Australia, it's often said that politicians think that the state ends at Jepps Cross, which is a 20-minute drive north of the Adelaide CBD. But that's certainly not true of me. As a Green, I'm only too aware that it's actually our farmers who are the custodians of our food future. And I also am very aware that it's the environment which sustains them and ultimately, of course, all of us. 30% of Australians live in rural areas, but they don't receive their fair share of resources and services. And this is particularly true and particularly troubling when it comes to health and mental health services and support for those who are living outside city limits. The National Rural Health Alliance stated, and I'll quote here, "There's a general downward gradient in health and health services from major cities to remote areas. The more remote the community, the poorer the health status of its people, and the less access it has to health services and health-promoting infrastructure." And indeed, people living in remote communities receive only 8% of the services, the health services and mental health services that their city and urban counterparts would receive. And just like urban dwellers, country people experience challenges to their mental health, and some live with enduring mental illnesses, sometimes for large parts of their adult lives. But country people have unique pressures, experiences and factors affecting their mental health, and then added to that they often have an additional pressure of stigma associated with mental ill health because they don't have the anonymity that people living in urban and city areas might have. While people living in country Australia generally experience mental ill health at levels equivalent to people living in urban areas, they encounter higher risk factors for mental ill health, including unemployment, lower socioeconomic status, poorer levels of education and reduced access to mental health services. So, to get a better understanding of the issues facing country Australians and what they needed in the way of mental health services, I set out to visit people in the bush and to listen carefully. Too often we see policies cooked up in Canberra or other urban areas and foisted on country people with the hope that they may have the desired effect. All too often they're not relevant, they're not responsive, and they're not ultimately owned by those people that they are seeking to assist. But I was determined to listen carefully and then set out to develop well-informed, responsive and practical policy grounded in the reality of the experience of those people who live in the country. So that's what we did. Over 18 months, I met with more than 185 people in 55 meetings across 6 states and 24 Australian towns. I met with service providers, carers, consumers and their families, and they all shared their stories generously with me. So while every person's experience is unique, of course, there were also many common threads. I particularly heard about and experienced the importance of community, the importance to us all of belonging. I believe every human being has a deep need to be acknowledged and validated, and my tour reinforced for me the importance of places in communities where people can go to feel connected. So it was that I encountered community centres and neighbourhood houses. And these were very, very important to the people who were lucky enough to have access to them, because they found them to be inclusive and safe places where often the focus was not solely on mental health, but wellness more broadly and connectedness and social participation. So I might share one story with you. I was eating lunch at Port Lincoln Community House in South Australia, sitting with other people there who'd shared their lunch that was prepared and served by other participants and people who used the neighbourhood house facility. So for a modest amount, and this was a common theme at many of the neighbourhood centres and community houses that I visited, for a modest amount, these people, many of whom are on low incomes, they were guaranteed a healthy and a sociable meal, at least once a week, sometimes several times a week, where they could come together and share their meal and participate. One woman who served me my lunch told me her story. She'd lost her home in bushfires that went through the Port Lincoln area some years earlier. She'd been severely traumatised and indeed had actually been found hiding away in a cupboard from people. She was ultimately coaxed out and she began to see a psychiatrist on a very regular basis. But over time, she also ultimately made contact with the Port Lincoln Community House and gradually became involved and felt validated and needed and valued in that by starting to participate in some basic cooking classes and then preparing meals for the shared meal and so on. And after a period of some months, her psychiatrist told her that in fact her healing was being more effectively dealt with by her participation in the community house, and she actually had no need to see him anymore. She was incredibly grateful for the experience that she'd had, and she sat down and shared that story with me. By the time I met her, she was attending regularly, she was confidently participating in the programs and activities, feeling valued and valuable. On my travels, I also learnt about the importance of outreach, actually meeting people where they are and reaching out to them, human to human. One organisation doing great outreach work that I encountered was an organisation called Rural, Alive and Well, with the acronym RAW, in the southern Midlands of Tasmania, also known by some of the people who considered it affectionately as Lifeline on Wheels. And basically they would go out in their utes and their vans and reach out to people who might be at risk of suicide, often based on tip-offs that they'd heard by other local people, maybe doctors, maybe neighbours. They also would do cold calling. They'd turn up, drive down the long driveway to the house, knock on the door, especially people living on isolated properties, to have a chat, a cup of tea, to offer a listening ear. And the person I spoke to there said he'd only been turned away once in all the years that he'd been doing it. I heard so many other stories about communities coming together to support their own in innovative, generous, caring ways. But of course I also heard alarmingly and constantly about a lack of services and about gaps. I heard from parents who are desperate to get help for their kids and grandparents who are desperate to get help for their grandkids, reduced alcohol and drug services. I heard about not enough support for people struggling to maintain their mental health so that they'd ultimately reach crisis point, and then they often have to be taken out of their communities to urban hospitals and crisis care, away from the relationships that help sustain them. I also heard about the need for more incentives for mental health professionals to work in country areas. And I heard about great initiatives overcoming or trying to overcome some of the tyranny of distance, such as travel subsidies, making public transport free 1 day a week, and coordinating underutilised transport with the help of volunteers. So after many months of listening, note-taking and joining the dots, my team and I collated the information and feedback we'd received on the tour and through an online consultation that we conducted, and together we developed a comprehensive report, Voices and Experiences, Improving Mental Health Services in Country Australia, with recommendations that reflected on what I'd learnt on my travels. These recommendations formed the basis of our 2013 federal election policy initiatives, which were fully costed by the Parliamentary Budget Office, coming in at $1.1 billion as a commitment to improving Australia's mental health system. But this commitment is far more than what can be measured in monetary terms. I often say, once you've heard a story, you know something, you can't unknow it. This has been an experience that I'll never forget, and something that will continue to shape my priorities and perspectives in this Parliament, both when it comes to the work I do within the Parliament and in the community. To put it simply, I believe in Australia, an Australia where all people have the chance to live full, productive and connected lives, no matter who they are or where they live. I'd like to place my thanks on the record to all those people across this country who trusted me with their time, their ideas, and their often very personal experiences.